Telehealth diagnosis for lower back conditions of various types is very much possible. I'm going to show you my favorite testing series that we do with our telehealth sessions here at Performance Place. Make sure to stay around to the last one because it's one of my favorite. Now, one simple test that we can do to help identify if pain is coming in the low back from something like a disc injury, other than history taking, is something like a flexion test or flexion compression test. So here's how we do it. We see a lot of telehealth people, so we end up doing this, we directed them to do it. And so what we have them do is first just slouch in the chair, and if they don't have any pain, we proceed further with the test. So if they don't have any pain, we can have them take sides of the chair and pull up like they're pulling their butt and chair together to squish it, and then have them relax. What this indicates, if there's an increase in pain, that there may be some issue with compression intolerance, or there's an issue with the disc as well. More tests can be used to confirm this diagnosis, and a skilled provider can provide a series of tests and find out the diagnosis of a disc injury without actually doing an image as well, but sometimes the image is needed too. Now, a lot of people have not really tested the lower back, and what we can do is we can find out what postures actually make it better and worse. We did another video on flexion testing. Now, in this one, we're going to try to have the person sit up nice and tall, like really, really good neurotic posture, if you will, throwing the ribs out at the world. And then to have them stay in this position for about 30 seconds. Do they feel worse or better? If they feel okay, we may actually add a little bit of compression to that, having them pull up on the seat cushion a little bit to really jam up the facets in the lower back. Now, if the facets are symptom generators or something like a facet syndrome is a problem or a Main syndrome, then this will probably make them feel worse. In that case, that is one data point to lend to that diagnosis, and we have other testing to do to confirm that diagnosis as well. This is called standing chemp's test. So I usually have them standing, feet together, and then have them put their hand on the opposite pocket and try to limbo into reaching down their pant pocket towards their opposite knee pit, and they can look over the shoulder to do so. And so here, and reach back. What some people do is they don't actually they just kind of slide a different way, so that limbo cue sometimes really does help. What we're looking to do is compact the facet joints in the backside. So when we do that and it increases their symptoms, we know there's a possibility of having something like a facet irritation or facet syndrome in the backside there. Wondering what else can be diagnosed via telehealth? Check out our other exam series that I have in the description below this video. And as always, if you want to work with us, please reach out.